So today we want to go through and talk a little bit about why we involve the families with addictions.
Okay, so where do you want to start with that?
I think it's really helpful when we talk about working with families that we, one, just take a big picture look at where we are in the landscape of addiction treatment right now. I think a lot of people are starting to become more and more aware of just how prevalent addictions are. They're starting to talk more about it, and I think especially with how many overdoses with opioids, it's just in the news and people know a lot more about it. But if we put some context to that, addictions affect a huge amount of the country.
Can we put numbers on it?
So close to 50 million people. And we live in a country that is about, I think, 340 or so million is where we're at right now.
Okay.
So not quite 20%, but a huge amount of people have some form of addiction.
I have 17.3% of people aged 12 and up.
Yeah. So that's including adolescents. It's a huge problem. And if you look at it specifically with alcohol, which is the most prevalent of all of those, that's close to 30 million people. So maybe 8 to 10% of people with alcohol use disorder, a problem with alcohol. And so just at that number alone it's a huge problem that we face in society, right? And so some people may be like, okay, well, what does that actually mean for our country? And so one, that means a lot of preventable deaths. So a lot of people with these addictions are dying much younger than they would otherwise. If we just look at overdoses, which is in the news quite a bit, we've crossed 100,000 a year overdoses. A lot of those related to opioids, but over 100,000 people dying much younger than they would otherwise. If they could treat this addiction, they wouldn't be dying, right? So you're losing a lot of years on a lot of people that are a lot younger, right? These aren't diseases that someone's losing maybe 1 or 2 years of their life. If they die of an overdose, they're losing a lot of years of life. And so we have a lot of death, mortality, but we also, if we think about how a disease affects someone, when we look at addictions, it's not just in mortality. A lot of that is the quality of life that they're going to have. So people with addictions, they're much more likely to get other medical problems, much more psychiatric problems. It's going to affect their ability to function as a family. So what kind of financial problems, die by suicide, much more likely. You're going to have a host of just decreased quality of life for them and all of those around them, right? So it's actually incredibly prevalent even just for kids. So if we think about kids that we want them to grow up in a healthy environment for them to thrive, 1 out of 8 is growing up in a family where one of the parents has an addiction. So
1 out of 8.
1 out of 8.
There are 30 kids on average in a classroom. What is that's like 3 or 4 of them.
That is going home to a family where addiction is affecting that family at the home. And you can just imagine that is going to impact that kid's quality of life and that kid's relationships and that kid's development.
So you're saying substance use disorder affects more than just the one person. There's a ripple effect.
Yeah, absolutely. The community at large, and it leads to a lot of suffering for that person and for the people around them. It's a very devastating thing to watch. It's not just about a number of death. It's a huge impact on that person's life.
Right.
And so we can zoom out and say, okay, so addictions are incredibly prevalent. It's, we talk about how many millions of people we're looking at here, and it's incredibly destructive. Like, these are diseases that are creating a lot of destruction on a lot of people throughout our country.
You were saying almost 30 million people have alcohol use disorder, and so that study is from 2022,
Yes,
and they're saying
2022.
within the past year, 30 million. So at any given time, 8% of the population is struggling with alcohol use disorder.
These are huge numbers. These aren't just like things that happened in the past and now they're done and dealt with. Like, these are things that are currently impacting the world.
Right. Okay.
Yeah, that's a good distinction. And so we can say, all right, addiction, substance use disorders, these are affecting a huge amount of people in a big way, that it is really important for us as a society at large. And then we can step back and be like, well, how many of those people are getting treatment?
How many?
If you just put in like a general percentage of treatment settings, like we're going to say inpatient setting, outpatient settings, they're going and they've received treatment in this last year, it's less than 10%. So if you say 50 million people and say less than 10%, just for my ease of
30,
math.
Okay.
Well, if we're using,
50 as a round number.
as a round number, we're talking about 45 million that are not getting treated in any sort of formal way. So it's a huge amount of people that aren't even in the setting of getting treated.
So the 3 kids in your class, 3rd grade class, whose families they're going home to that have some kind of substance use disorder, 90% chance that each one of them is not actually
getting any help.
That's,
yeah, absolutely. They're going through this suffering alone.
Right.
In some way or another, and they're not exactly sure how to change or how to get that kind of help when you're going through that alone. Mm-hmm. And so, and you can also look at medication. So the numbers are better for opioid use disorder, but for alcohol use disorder, the amount of people who actually end up on a medication, mm-hmm. which is FDA approved medications that help people with alcohol use disorder, it's close to 2%.
Oh my God.
Yeah, so you say 30 million people, it's very few of them are actually getting treatment at all, and then even, probably appropriate level of treatment is even lower. So there's this huge gap of people that aren't getting treatment.
Okay.
And because they're not getting treatment, there's all of these huge ripple effects on that person, their
right.
family, society. And so then we can step back and say, we can see it's a problem. Mm-hmm. What do we do about it? Why are so few people actually getting treatment? And I think that's where there's really a lot of opportunity for us to think creatively of how can we tackle this problem.
Okay.
And there's a lot of people that are trying to tackle this in many different ways, but I think an interesting way to get at this is actually the family and the community at large. And so if we look at a lot of these people aren't getting treatment, why aren't they getting treatment? And I think that there's actually an interesting couple of reasons. Anyone who's worked in an emergency room has probably been in the experience of seeing, or even family members, of a person not necessarily wanting to get help. And it's a very tricky thing of substance use for most states is a voluntary treatment. And if someone doesn't want to get help...
Wait, hang on. It's a voluntary treatment, meaning the person has to identify that they have a problem.
Exactly. They have to realize, I want to change. I want something to be different. I have a problem. Any of those kind of realizations.
We're getting into psychology now.
Exactly. So if they don't even recognize that they have a problem, which I think neurology has given us a lot of information on this, in psychiatry, there's a term, anosognosia.
Okay.
Which I don't think the term matters so much, but just to give you an idea of how drastic this can be, is a lot of where this came up, if I remember correctly, is people who had strokes where half of their body would be completely paralyzed. So if you're looking at me, I can move my right arm around. My entire left side of my body is not working. There is, if it affects a certain part of their brain, where they don't even recognize that something has changed. So their whole left side of their body is not working, but they think they're completely normal, no problem, no conscious awareness that anything is wrong.
So there's a gap between the reality of what's going on in their brain and the reality they are perceiving.
Exactly. That their ability to be aware of there even being a problem, there's no ability for that.
And you're saying this happens in stroke patients?
So that ties it to there's a place in the brain when injured. So there's a brain capability of us recognizing it's a problem.
This is a thing that happens. Is this something you see commonly in people with substance use disorder? Is this where this is
going? I think the idea is, so it's a problem that can happen in our brain.
Okay.
Right? A lot of what we learn about different sort of brain anatomy and function, especially early on, before we could do some of the advanced studies we do now, is related to when parts of the brain get injured, what happens. And so as we've seen, when parts of the brain get injured with different kinds of neurology problems, they don't even recognize they have a problem. So we tie that into psychiatry because we see it a lot in psychiatric and mental and substance use disorders, is they may not even see that there's a problem.
Right.
So you have that bucket of people who may not even be able to recognize just from a neurologic point of view.
Right.
Then you look at the second piece of, there are many people that probably can say like, something's not right here. They have that awareness, but they may not have any motivation at that given time. And as you can imagine, I'm sure you've had the experience, most of us have, of I have the intention right now that I don't necessarily follow through later. So say, for example, at night before I go to bed, I want to go to the gym and I'm very motivated to exercise and to do all these things. And I have all these reasons of why I want to do it. I have a plan. I've made it all out. I get up in the morning, my alarm clock goes off and I hit snooze. And I'm like, there's no way in hell. And as soon as I feel that alarm clock go off, I have no desire, no motivation to go in and do that.
Okay.
And so motivation is a fluctuating thing. It changes from a whole host of things.
Some days you want to do it, some days you don't.
Yeah. And it's influenced, right? So in addition to it fluctuating just on its own, there's influences, right? Like we're talking about at night before versus waking up in the morning, which there's a lot of things that go into that, but even just in a dialogue with a person. So there's a lot of studies and a lot of evidence around using what's called motivational interviewing.
Okay.
In the clinical setting, so say someone is ambivalent, which is the term we use for a lot of things, but in addictions especially. There's part of this person that wants to change and there's part of this person that doesn't. And maybe even when they come in, it's 99, I don't want to change.
Okay.
Very little of them is motivated to change. Some of them are very higher on motivation. But we work with them in how to just talk in dialogue that's much more likely to change towards change. It's much more likely to engage them in dialogue in a way where they have more motivation to change.
So this is a skill set that you're trying to teach people, and it can be used in any context. I'm assuming we're going to talk about how we're using it in the context of helping someone with a substance use disorder, right? But you're talking about a skill set where you can help people learn to communicate in a way that will motivate someone to do something.
Exactly. Which, especially in addiction, where motivation and ambivalence and behavior change is at the crux of what we're working at, we need to, our goals, if someone is struggling with addiction, is to help them get out of addiction.
Right.
And so part of that is a change in behavior.
And you want to motivate that change in behavior.
Exactly. We want to motivate that positive change in behavior. And there's actually really good ways of just talking to a person that shows that they're more likely to think that way and they're more likely to change their behavior in that way.
That seems very simple. I mean, people, the 2% of people of the 30 million people a year struggling with alcohol use disorder, you see less than 2%. Like the people you are seeing and prescribing medications to is less than 2% of those people, right? You're seeing a very small population of those people. And from what you've told me anecdotally, like these are people who have a lot going on in their lives. You're telling me something as simple as learning to talk to them differently is going to make that big a change?
So I think it's a good thing that we've looked as a healthcare system, and this is by no means universally carried out. But if we can train people in the healthcare setting to use these techniques, we're much more likely to help that person move towards change. So that's a lot of where that's been initially kind of invested and created is, so say when you see your primary care doctor, if they've learned how to engage you, I mean, even in things like diabetes, right, is part of the challenge with a medical problem like diabetes is it's very hard to adhere to all your medications. It's very hard to change your diet, your exercise, all these things that are going to be good for your health.
Okay.
But if we can train the provider to engage someone in a way that actually increases their chance of making those changes, we're going to have much better outcomes.
Let's do a pretend version. Can you give me an example? Can we do a pretend dialogue where a provider is not using motivational interviewing, and then one where they are, so that I can understand the difference?
I think the one that people can probably resonate the most with is, we've all gone to our doctor who's probably a little overwhelmed, overworked, and doesn't have a lot of time with us, right?
Right.
And we've had the experience of, say, our labs don't look quite as good as they want. Say our cholesterol is high, the markers for glucose are high, and they're trying to tell us you need to eat healthier, right? There's
Okay.
some problems that we're starting to see, and eating healthier is going to be better. So if you can imagine, you go into your doctor, and he or she is just like, okay, your cholesterol's high, your sugar's starting to get high, your weight is elevated. This is all leading towards risks for your heart, your weight, all these problems that are going to be coming down the road. You should really talk to a nutritionist, and you should start eating less processed foods. You should start exercising more regularly, and this is how you're going to prevent it. And then maybe spend 5 minutes or so, just kind of briefly, this is what you should do, or here's the problem, here's the solution, good luck. I think we've all had that kind of experience. And I, by no means do I blame the primary care. I think that they have a lot of stressors that make it hard for them to do all these things. But there have also been efforts to either train the primary care doctor or have an additional staff member come in and have more of a conversation, which is more of a conversation, right? So you can imagine it like you come in and I show you these and be like, hey, is it okay if I show you some of the labs that I got? Okay.
So then you get this person engaged. Yes, show me the labs.
Yeah, exactly. And I say, okay, so we have here is your A1C. What kind of information do you know about the A1C?
I don't know anything. What can you tell me?
So this is a marker in a simplified way of, glucose, what your average glucose is. And it, in a way, helps us get an idea of if you have diabetes, if you're getting close to diabetes.
Am I getting close to diabetes?
So in this example, I could say, well, you don't have diabetes, which is good. That's reassuring. But how we see it trending means that you're moving in that direction towards diabetes. I can see that you look really scared about that. What's your understanding of diabetes?
That it's a horrible, it's life-threatening. My grandmother had it. I know it runs in my family. I know it wasn't good for her.
So you've had some personal experiences of people having diabetes.
Yes.
Is it something that cost them their life?
I don't think it cost her life, but she almost had her leg amputated at one point.
So she really had some serious medical complications because of diabetes. So it sounds like you're pretty worried about getting diabetes.
Yes.
Yeah. Is there any other worries or thoughts that you have related to getting diabetes?
Well, I've seen diabetes come with high blood pressure and high cholesterol. Is that correlated? Do they come together, or?
These aren't necessarily like if you have one, you have the other, but they do add risks together. And it sounds like you really value your health and you want to make sure you're taking care of your health.
Yeah.
What kind of things do you do to take care of your health?
Well, it could be better. I could go to the gym more. I could eat a few more salads a week.
Yeah.
What should I do?
So if we just kind of pause from there, because I think
And that's motivational interviewing.
You can tell there's a lot of techniques that we could use from there, but we want to elicit why that person cares about it. So we want to understand
why the person
exactly.
With
We
the
want
problem
we
needs
want you
care.
exactly. We want you talking about what's the reason that you don't want diabetes,
Right.
right? What's the reason that you want to go a different route? We don't want someone over here preaching about what they think, because one, you're not engaged, and two, it's not necessarily personal, right? So if I teach you something, that doesn't necessarily speak to what's most important to you. If you're telling me what's most important to you, you're saying why you want to do it, and you're making it real right then and there of why you want to do something different. So motivational interviewing, we will do a video later to really step into the depths of it, because I think it's a really useful tool. But I think the thing that's most important for people to understand in the context of this video is motivational states change, and there's good evidence that they can be influenced in dialogue with another person. And there's been a whole lot of push of how we can use this in the medical setting to help people get to a better place of either getting treatment for their addiction, getting treatment for their medical problems, all sorts of ways in which they can improve their quality of life and their health care, and the actual implementation of the evidence-based treatments that we have.
You're saying that's been studied and it's high?
It's helpful. It's very helpful.
It's very helpful. Okay, so who is doing the motivational interviewing? How does motivational interviewing help us with substance use disorder?
Yeah, so I think that's part of where I want to connect this back to family work and family therapy is, so we've kind of shown that this is a huge problem and a lot of people aren't going into treatment, right? And so you can imagine a lot of people aren't even engaging in the healthcare system.
Okay.
Or a lot of the...
90% of people are going untreated. 90% of people are not seeing a formal healthcare advisor
for their addiction, right? So there's less of that if you talk about people who are still seeing the healthcare treatment in some setting.
Okay.
And so there's ways in which we want to use the healthcare system to try to engage those people. And that's part of that's motivational interviewing and trying to improve our delivery so that people actually want to get engaged and we're offering something that's better for them that they're motivated to receive. But there's also just the reality of it is a whole lot of people aren't even interacting with the healthcare system. So even if part of the solution is how can we fix the healthcare system to make it better for people, there's still the reality that a lot of people aren't even engaging with us, right? That still have this problem that's having this huge impact on them and their family and no treatment. And so that's where we look at, okay, if they don't recognize it's a problem or their motivation isn't high to seek treatment, is there anyone else around them that may be motivated? And we do see a lot of families who are maybe they're not in the addictive process, so they have a little bit more perspective where they're able to see some of the problems that it's causing. So they may have more clear motivation. The family may have more ideas of why they don't want that person to be using. They may be suffering some of the consequences, right?
So they're not having this disassociative, this is the reality, but it's not a problem. They can see clearly that the reality is a problem.
So families, I don't want to give families the clairvoyance of knowing everything, right?
Right.
But if we just look at that example from neurology, they don't have the same thing going on in their brain.
Right.
They don't have the same cycle of states changed from the drug going in and out and the way in which the drugs are affecting their brain. So they do have an ability to have a perspective that the person in the addiction doesn't.
Right.
And because of that, they may be more motivated to seek treatment.
Okay.
And they have a huge ability to have an impact.
You're saying the family can seek treatment?
Yeah, absolutely.
What does that look like?
So I think before I jump into what the treatments are, I think a good example that we're starting to learn about is just as far as treating addictions. A lot of addiction research has actually been done on animals, and there's some of the earlier studies and things and information we gathered. We didn't realize the impact of socialization, and so a lot of different animals, we got them to where they were addicted and they showed behaviors of addiction, and that was very, it helped provide a lot of information and learning about addiction and how that process works. But as they've started to become more nuanced, we've started to use socialization as a tool to kind of challenge the addictive process. And there's been a lot more studies of actually using social rewards for mice or rats. I don't remember which one off the top of my head, even though they are different, to actually deter them from addiction. So the mice, I'll just say mice for now, just because I don't remember. The mice were addicted to methamphetamine or heroin, and with socialization as a reward, actually improved and changed their behavior a huge amount. And this is
So girlfriend, boyfriend mice are over there having a party, and the one who has an addiction is like, oh my God, wait, but there's socialization and I'm missing it. And something about that socialization can pull them back away from the drugs and help improve quality of life.
Absolutely. And granted, we can't say what happens in an animal study is perfectly translatable to a human, but what we can say is socialization is, if anything, more important to humans than most other species. I wouldn't say that socialization is less important to our species, and so we can clearly say socialization is a powerful tool in recovery.
Okay.
And you see that with AA groups where social communities can be huge impacts on people's recovery.
Okay.
And so we look at that and be like, okay, so socialization can be a very powerful tool. The manner with which we talk to someone can be a very powerful tool. What about some of the other behavioral strategies? Anyone who's done psychology classes can remember classes on Pavlov, Pavlov's dog. It's okay, many people don't know the experiments and we don't need to go into the details of it, but the idea of it is...
He rings the bell and the dog knows the bell means it's time for food.
Exactly. They get the bell associated with food,
Right.
and the dog actually has a biologic response to that.
Right.
Right? So the dog starts salivating
Right.
to the food.
Right.
But by the end of it, the bell rings, the dog salivates.
Right.
So the dog has a biologic reaction to something that it normally would never have a reaction
Just
to.
the bell, right.
And this is really important in drugs because we know a lot of things, people, places, things. They talk about that a lot in recovery circles. That there's these triggers that are more likely to lead them towards drugs. This can be an emotional type trigger. This can be a physical trigger. This can be someone walking by the liquor store, seeing the alcohol. All of a sudden, their entire body state is preparing them to use that drug. And so that's kind of the classical conditioning of behavior that we'll look at. But then there's also the operant, which is more the punishment and reward. People use these terms probably not perfectly scientifically, but I think it gets to the gist of the idea of a reward. You give a kid a reward when they do something you want them to do, right? So if anyone's raised a child, they know that if you want them to keep doing their chores, sometimes you want to give them, 5 minutes to go play outside or something that they really like that makes them say, oh, this is really good, I'll keep doing this. Versus a punishment is doing something, some sort of stimuli to make it less likely for them to do that.
Right.
So this one people will use probably a little bit less precisely, but you can think of the idea of, people probably are not as for spanking at this point in time, but that's clearly a punishment of they did something that you don't want them to do, and you're trying to have them change their behavior. And so punishment and rewards we can think of as, okay, well, if we understand addiction as a behavior, you can look at the conditioning before these kind of triggers and cues, but you can also look at the punishment and rewards and how can we try to change their behavior from the behavioral sciences that we have here. So if we kind of zoom back to where we were asking about, well, where does this get to families?
Right.
And how are families involved? It's okay. So socialization is incredibly important.
Right.
Motivational interviewing is incredibly powerful, talking to someone and impacting their motivation states. And we have a lot of behavior science that can influence people's behaviors. These are powerful tools that we know about. Well, what about if the person close to them learned and got really good at using these tools?
Okay.
So if you can imagine anyone who's gone to treatment, it's very common outpatient treatment. You may see someone once a week. There are some more intensive forms of that, but general outpatient treatment, you're seeing a therapist 1 hour a week. So if you, say, are struggling with an addiction and you're seeking treatment for 1 hour a week, that's 1 hour out of, I don't remember how many hours are in a week, but 7 times 24,
Right.
a lot more than one. And so there's a lot of hours that you are not in treatment, right?
Right.
If you have a loved one, say a parent, a spouse, someone who's very close, they're with that person many of those hours. If they were able to really get good at these skills and useful with them, that's like bringing that treatment to the person's home throughout the day.
I mean, that's amazing. You're not talking about, me becoming a therapist for my boyfriend who has a substance use disorder. You're talking about me being able to have like bumper rails on the bowling lane and say, let's try to guide you a little bit, and the way I start speaking to him will help move him in that direction. Is that what you're saying?
Yeah, that's a really important distinction, is we're not telling anyone to be a therapist for their family members, and I don't think that, anyone's going to be happy with that situation, but it does help that person, that family member, understand that there's ways in which I act and ways in which I interact with this person I really care about that can help them succeed in recovery, that can help them get out of whatever trap they're in right now. And it's by no means easy, and it's by no means the person's fault who's married to that in that situation, who's the parent raising a kid who's in this situation. It's not their fault that they're in that situation. They didn't do anything that caused it. But at the same time, there are really useful tools that can help them be part of the solution, part of the recovery process, when they don't necessarily want to seek treatment at that time.
Are you saying that piece of it because you see the family around someone with a use disorder having a reaction to feeling like they need to be part of the solution?
I think we have to be cognizant that it's a really difficult place that families are in. So as you can imagine, if your child is going through an addiction, if your spouse is going through an addiction, there's a lot of suffering that you've gone through as well. And there's a lot of hurt that can be done, and there's also a lot of questions of why it's this case. And I think it's really important that people aren't blaming themselves for the situation that they're in, because a lot of that can feed any sort of guilt, shame, and actually make things more difficult. And the truth of the matter is, it's not their fault. There's all sorts of genetic factors. There's all sorts of reasons that a person gets into addiction that has nothing to do with a family member. But that's very different than saying that that family member can't be a powerful part of the solution. And the fact that we have good tools out there that are evidence-based of working with family members who actually may have a skill set or perspective that that person with the addiction doesn't have means that they can be an ingredient to success, even if they weren't part of the reason that the problem is there in the first place.
That's a tough place to be. How do you normally, so you work with a lot of people with substance use disorder, how do you normally receive family members? Like, what state are they coming to you in, and how do you get them motivated to help change the motivation of the person in their life struggling with that?
This actually touches to probably a big problem that people recognize being in the family is with all the HIPAA regulations. A lot of times family members aren't even allowed to be involved. Is that we as providers cannot speak to the family, at least we cannot divulge any information unless that patient allows us to.
Wow.
So there's strict rules around us being able to engage them, and I think that there's a lot of caution then, and even just time that providers have, which can get in the way of engaging in families, which is a big problem. I think the more we're able to engage that unit, the better that we can really do and serve our patients.
If it's so difficult for a family member to even understand what's going on, for whoever in their life has this problem, there already has to be some cooperation on the part of the person with the problem to let the family member in.
If we're talking about the direct treatment of the patient, yes. They do have to allow the engagement of their family members, but that is different than saying a family member seeking treatment for themselves, which is where craft, I think, is a useful tool. Is, remember when we got to that huge amount of people that are in no treatment at all?
Right.
So say a family member is in a situation where they're like, yeah, this is a huge problem. My husband, my wife, whoever I'm worried about, they're not seeking treatment and they have no desire to seek treatment.
Right.
Which, as we can see by those numbers, it's a real problem and a very common situation. So that person instead can say, well, what can I do to help myself with the suffering I'm going through? Or what can I do to help this person be more likely to go to treatment? And CRAFT is specifically designed to work with that group of people.
CRAFT, is that an acronym?
That is an acronym. It stands for Community Reinforcement and Family Training. So it basically integrates a lot of these principles that I was talking about to work with, they're called concerned significant other. So it's someone who's close to that person with an addiction, on how they can take care of themselves, how they can interact with the situation, how they can learn some tools that's going to improve their quality of life significantly. It's going to lead to decreased substance use for their family member, and it's going to greatly increase the amount of family members that do go get treatment.
I just imagine so much of the dynamic between the person who's having the problem and the concerned significant other. Don't you often see like a much deteriorated relationship as a result of that person's usage?
of course, there's huge impacts on the relationship, and there's a huge amount of variety as well. Like, it doesn't necessarily mean that the relationship is gone, but whenever someone does seek treatment, there's a lot of that needs to be kept in mind, is that there's a lot of pain usually and suffering. People have said things, people have done things that really have left scars, and they're things that we do need to address and navigate, and trying to help them get to a place to really feel like they can make a positive change. And we don't want to minimize the difficulty of the situation that they're in by any means.
So how does one go about trying to help their person who has this use disorder with these techniques?
So I'm definitely in the show notes below including some of the links that you can look to find a craft therapist. And there are also books. I'll include a link of some books that do go into more depth about some of these principles to learn more information. I do always encourage people, if they're able to, working with a therapist. As anyone can imagine, these are very difficult situations to navigate. And part of the benefit of having a therapist is you're trying to learn a whole new skill set. Like, you're trying to learn a whole bunch of different ways to interact, and you're trying to change your behavior.
You're looking for a craft therapist.
Yeah, specifically someone who does craft therapy, which many providers don't. It's not, This is not something that is everywhere, that everyone knows how to do and everyone can do.
This is specific to addiction, family therapy.
Yeah, and providers that so I've done trainings on craft, I've read books on craft, I have not gone through the prolonged craft certified training to be a certified craft provider at this point. That is something that I want to do because I see it as such a need for society and for so many families. And I see so few providers that I do think increasing that availability is really important. But a link below does include actual craft therapists who are certified, who can help work with people. And the reason it's so helpful is, if you can imagine, any sort of person who's trying to change, even just professional athletes use coaches and people to help them perfect the craft and what they're doing, or the skill set that they're doing, to use craft multiple times. And so the ability to work with someone who's coached, provided therapy for all of these different families, and help them go through a process similar, is so valuable to really learn these skills in an effective way and manage some of the obstacles and challenges that are going to come up. And just wrapping up the whole discussion today, is we started looking at how prevalent addictions really are throughout our country, and why it's such a problem, and why a lot of people aren't getting treatment, or good treatment necessarily, which leaves a whole bunch of people suffering without any help. And taking through that is, there really are options for that group of people, and there really are good behavioral strategies, motivational strategies that families can use to help make a difference. And I think that's the important lesson of this whole thing, is to tie it in together, is that families can be a critical part of really improving this, and that there are resources for families. And that's going to be a big part of what I'm doing with this YouTube channel and this website, is I want to increase those. So if there's more questions you have, if there's more areas where you're having trouble finding resources, that's what I want to do with this. And please, leave a comment down below, include what ideas you have would be helpful for us to make this better for you guys as well. And so really just wanted to say thank you for joining. Appreciate your time today. And I'm Dr. Matt Campbell, and look forward to talking to you next time. This has been another episode of Conversations with AcroPsych, hosted by Dr. Matt Campbell. Thank you so much for watching. Please leave a comment below for the topics and resources that you want to hear about as our next general educational topic. This video and all information put forth is for general educational purposes. It does not form a doctor-patient relationship. It does not provide any medical advice or individual care. It is in no way a replacement to your medical professional, and we recommend seeking appropriate professional assistance with all your healthcare questions and needs. For any psychiatric or medical emergencies, or any safety concerns at all, please utilize appropriate emergency services. This includes 911 or going to the nearest emergency room. For needing to speak to a mental health counselor, there is 24/7 hour hotline that you can reach a crisis counselor.